I'm Dr. David Greene, CEO of Preferred Pain Center here in beautiful sunny Phoenix, Arizona. Today I'm talking to you from Tempe Town Lake, which is a man-made lake out here in front of Arizona State University. Across the lake here you can see the Arizona State University football stadium, where evidently they're having the Insight Bowl tonight, which explains why it took me 30 minutes to find a parking space. But today's topic is the 3 secrets of pain management. Now, there's probably 100 secrets of pain management, but today I want to talk to you about 3. First secret is that comprehensive pain centers are better. Now, to people who've been through a comprehensive pain center, such as Preferred Pain Center, this is no secret. I did an interview with a patient this morning, which is also posted on our YouTube channel, talking about his experiences with singular treatments prior for his bulging discs with sciatica and leg pain, and then comprehensive treatment at our pain center lately. Basically, when someone has sciatica, for instance, and they go through singular treatments, whether it's spinal decompression or maybe physical therapy, one-off types of treatments, oftentimes that doesn't quite get the patient better. But if the patient can be going through at the same time some physical therapy and then maybe spinal decompression, some chiropractic treatment, and then epidural injections, patients can get dramatically better in a very reasonably short time frame. So the patient I was speaking to this morning, Josh, he had bulging disc with sciatica, and within a few weeks he had an epidural injection, he had some spinal decompression treatment, some physical therapy. His pain went from an 8 out of 10 down to a 1 out of 10. He's back teaching again, he's a teacher at a high school. He's playing with his kids. He had a great Christmas with them and Hanukkah. So he was able to enjoy the things in life that make life what it is. Because at Preferred Pain Center, that's where your pain stops. So comprehensive pain centers include things such as physical therapy, chiropractic treatment, interventional pain injections, medication management. A lot of pain centers will not do medication management, maybe for liability reasons, maybe their doctors aren't comfortable with it. Ours are. We offer all of these things in addition to such things as acupuncture, chiropractic, manipulation under anesthesia. If you have all of these options available in the armamentarium of pain management, the results tend to be better, and ours are. The second secret of pain management is managing expectations. Patient expectations are key to an end result. If the expectation of a patient is that they come in with a pain that is, let's say, 9 out of 10, and that very quickly they're going to be at pain-free status, that is not always a reasonable expectation. And that can be borne out in the workup when you can see in the history and physical, where a pain doctor can see if a patient has had 3 failed back surgeries and they have continual radiculopathy, leg pain from a nerve problem. If that nerve problem is from scar tissue around the nerve, it is unreasonable to get rid of all that patient's pain. So expectations need to be realistic. If the expectation is that all the patient's pain is going to get better, and the patient understands that they're in for a very good result, that's great. But if the patient feels like they're supposed to get all their pain is going to be bye-bye, when in actuality, the expectation should be that maybe 50% of their pain is going to get better, what happens if only half of their pain goes away? That's going to be an unhappy patient. So one of the secrets to pain management is expectation management. Therefore, the patient knows what to expect reasonably, and the physician is able to tell the patient more or less what they're in for. There's no guarantees in medicine. Even with all this modern technology, there's no guarantees. Which brings me to the third secret of pain management. Technology is often great, but sometimes it's not so great. I'll give you 2 examples. One, technology is great with radio frequency ablation. Radio frequency ablation, of which I've talked about before, and it's in our newsletters, which are on our website, as well as isuu.com. Just type in Preferred Pain Center newsletter. Radio frequency ablation is a state-of-the-art modern treatment for pain management where a pain doctor can deaden those tiny little nerve endings that are causing pain either in the low back or the neck. It can give up to maybe 2 years of pain relief. So radiofrequency ablation is a great technological advancement and is at the forefront of pain management, and our pain doctors do that. By the way, they're board certified and fellowship trained. One area where technology, I don't think, is so fabulous is in all this fancy schmancy physical therapy equipment. Why do patients need that? It looks good. It might make them feel like they're actually in a gym or a fitness center. It is not necessary. If a patient goes through 12 or 20 treatments of physical therapy and then their sessions are out and they are supposed to be put on a home program, which our patients are, how are they going to do that if they're going to have to join a gym, go to the YMCA or something like that? That shouldn't be the case. Low-tech rehab equipment, in my opinion, is the way to go. That's what we have. That's why patients can do it very comfortably while they're there. Oh, and look, they can do it while they're at home. So they can continue with preventative and prophylactic